Patented products. Stereo retractable auto-disable syringe. Having obtained 3 patents, this stereo retractable auto-disable syringe is the existing domestic product with the most simple structure and the most stable and superior performance. Fully automated mass production has achieved and can meet the needs of users. With transparent barrel, clear scale, convenient push and pull, and comfortable touching, it will not fail even if you push the piston to the end. Many current products cannot achieve this. A push to the end and it cannot be used again. The product's needle is fixed firmly. It will not automatically draw back, thus losing sealing performance when the needle is being filled and during injection. Standard needles are used. Needles of different specifications can be selected according to clinical needs. In each injection, the piston can be pushed to the end to inject all the medicine and will not fail. Fill it again and you can continue to use it. That is to say, multiple injections can be applied to the same patient, saving the cost for patients, and nurses do not need a new syringe to complete the remaining injection. This is necessary in clinical practice. For example, surgical patients may need repeated anesthetic injections. Also, some patients need several kinds of medicines to be injected. When the nurse confirms the injection is completed, apply by hand a force of not more than 25 Newton. The gap behind the piston disappears, and the finger also feels that the plunger moves forward a very small distance, and then the syringe's safety mechanism is activated. When pulling the plunger, the needle in front can be put back into the syringe. Continue to put the plunger back until you hear a crisp clip sound, which indicates the plunger is locked. Break the plunger along the breaking line so that the needle contaminated with the patient's blood is completely shielded inside the syringe. This retractable auto-disable syringe can completely protect the needle contaminated with the patient's blood, so that it will not cause harm to nurses, hospital cleaners, garbage transporters, and incinerators. Meanwhile, the syringe cannot be used at all, and it can no longer be used in the second patient. Therefore, the retractable auto-disable syringe achieves a real two-way protection. When the nurse confirms the injection is completed, the needle can be pulled out from the patient before the activation operation. This is very practical in clinical practice. But if activation is applied when the needle still stays in the body, the needle will cause pain to the patient due to movement of needle during activation. The international standard ISO 7886 raises new requirements for the selective activation of safety devices, and our retractable auto-disable syringe fully meets this requirement. Medical workers can choose to activate the safety mechanism after the injection on a patient or multiple injections on the same patient. More importantly, activation can be done outside the body, and a complete destruction of the syringe can be realized. It is a clinical concern for clinicians that users can determine whether to trigger the safety mechanism to disable the injector according to the need. 2. Automatic liquid stop infusion set. Automatic liquid stop infusion set is made by adding a stop device, a floater in the traditional infusion set. When there is liquid in the drip chamber, the floater suspends a net. When the liquid runs out, the floater drops to the outlet with the liquid. The floater's silicone pad coincides with the drip chamber outlet to form a closed device, so that liquid no longer drips down, achieving the function of automatic stop. If we use 2 different infusion sets to simulate clinical infusion, the principal and effectiveness of automatic liquid stop infusion set can be displayed. In simulation, when the first bottle of liquid finishes, we can observe the different results in the 2 infusion sets after the liquid enters into the drip chamber. The liquid in the automatic liquid stop infusion set stops at the drip chamber outlet, completely preventing air entering the tube, so that the nurse does not need to rush dispensing, changing medicine, or exhausting air. Just a pinch of the drip chamber can resume normal infusion.